According to the American Diagnostic and Statistical Manual of Mental Disorders, 1 out of 5 adults in the United States experiences at least some form of mental disorder. And every single day, someone asks Google that question: am I having a mental disorder because of my highly sensitive perception? Welcome to today's episode. My name is Robert. I'm a highly sensitive person myself, and in today's episode, we will talk about the question: is a highly sensitive perception, a sensory processing sensitivity, a mental disorder or not? We look into all the data given to that certain point, and after today's episode, you will understand what a mental disorder is, why the definition of a mental disorder might not be very helpful, at least in my opinion, which coping strategies are helpful for highly sensitive people and which coping strategies might not be very helpful, if treatment and medication are necessary for highly sensitive people, and if a sensory processing sensitivity actually is a disorder or not. We start, as always, with some definitions here. And I want to start with a really quick summary what actually a highly sensitive person is, because if you stumbled across this channel for the very first time, you might not know what a highly sensitive person is if that's the first episode you ever listened to on that channel. If you already watched a couple videos on my YouTube channel, if you listened to a couple podcast episodes, you are definitely aware what an HSP is. Maybe you all already identified yourself as a highly sensitive person. The quick definition for you, again, is that a highly sensitive person is someone with a heightened perception and a really sensitive nervous system. A highly sensitive person has also a more pronounced reaction to outside stimuli, and a highly sensitive person is, in, let's say, the medical context or the scientific context, a human being or an individual with a sensory processing sensitivity. Short form in literature is SPS. Dr. Elan and Aaron is the leading researcher and scientist in the field of high sensitivity, and according to her, 20% of the population are highly sensitive people with SPS, and the trait is also equally spread in women and men, or in females and males, because it is also found in over 100 other species. So it is a really widespread trait or phenomenon which is found in many species on this planet. Let's go on with the definition of a mental disorder. And just pronouncing the word disorder makes me a bit shaky here, but let's find out. So I looked this up for you. When we try to find a definition of a mental disorder, if you ask Wikipedia, they say a mental disorder, also referred to as a mental illness or a psychiatric disorder, is a behavioral or mental pattern that causes significant distress or impairment of personal functioning. That said, I digged in a bit more and I found out that especially for highly sensitive people, but also for people on the autistic spectrum, for people with ADHD, for people with childhood PTSD, because we all come across that definition of a mental disorder from time to time if you feel to categorize yourself as one of these. So I found out that there might be, at least in my definition, a problem with this definition of a disorder. So let's spin around with it here for a bit, because I think it's really interesting. And I have to say at first, I'm not a professional health practitioner myself. I'm also not a therapist. I'm a highly sensitive individual. I'm a scientist because I studied human nutrition, so I know about human physiology, I know about psychology, but I did not work with clients in the field myself. I worked as a client with many therapists, so I experienced the side of being a client here as being someone classified as a highly sensitive person by a psychologist, being classified as someone with a mental disorder. So it's really interesting to look into that definition and to set up that clear definition of a profile to make illnesses and divergences categorizable. I think that is pretty helpful for health practitioners, for psychologists, for everyone who works with people who have, let's say, mental challenges. But I would say as always that a personality is a hyper-complex field, which is, in my opinion, super difficult to categorize or to find like similarities. And this is what psychology is doing here, at least in the clinic field, to find similarities which you can put in the box and label it as, for example, post-traumatic stress disorder or autism spectrum disorder. So that said, what does that actually mean? Significant distress or impairment of personal functioning in relation to what? To actually functioning in the society as we know it. Does that mean in relation to this normal world we actually built, in that normality? Someone or something sets a normal here. But who actually says what is normal? Who is that someone or something? And what is that standard? And what is a non-normal divergence? I think that's more of a philosophical question here, but it's really interesting to look in where actually these categorizations come from, where actually these standards, this normality comes from, and who set this up, who decided what is normal, who decided which part of society includes which people with which kind of brain architecture, brain structure is categorized as non-divergent or is categorized as having a mental disorder, for example, like autism spectrum disorder, or is categorized as being highly sensitive. If we ask the Diagnostic and Statistical Manual of Mental Disorders here, the so-called DSM published by the American Psychiatric Association, we put, as I said, ASD, for example, autism spectrum disorder, CPTSD, complex post-traumatic stress disorder, or ADHD as mental disorders. In the DSM, the definition of a mental disorder or mental illness is that mental illnesses are health conditions involving changes in emotion, thinking, or behavior, or a combination of these. Mental illnesses can be associated with distress and or problems functioning in social, work, or family activities. They also say that mental illness is really common, and in a given year, nearly 1 in 5, so 19% of the US adults experience some form of mental illness. 1 in 24, 4.1% has a serious mental illness, for example, major depressive disorder, schizophrenia, and bipolar disorder. And 1 in 12, 8.5%, has a diagnosable substance use disorder. But they also give us hope, and they have great news for us. First of all, mental illness is nothing to be ashamed of. It is a medical problem, they say, just like heart disease or diabetes. And a mental illness is also treatable. The vast majority of individuals with mental illnesses continue to function in their daily lives. As we discussed in the previous episode about autism, which is categorized as a disorder, it is still unclear whether HSP is a type of form of autism itself or a whole different thing. But let's summarize one thing here. According to the American Psychiatric Association, ASD and ADHD, for example, are categorized and compared as medical problems such as heart diseases, which are, by the way, the most common cause of death in the United States of America. So again, if you have a mental illness, according to the American Psychiatric Association, you have something comparable to a deadly disease. This is what they put on their website here. And I would argue that this causes many people, including me, to feel that there is something wrong with them if they read it. Of course, it's treatable, for example, by medication, and we will get to this point later in this episode as well. But again, that does not take away that weird feeling you get when you are diagnosed as someone with a mental illness. Just, for example, if you are on the autistic spectrum, or if you are a highly sensitive person, and if you read about that high sensitivity might be a type of form of autism here. I think this definition itself could potentially lead to more negative thinking and depressive states, which are again categorized as mental illnesses. So just reading this definition of a mental illness, or just having some form of categorizable mental illness, might lead to a devil's circle of creating more mental illnesses here. This is the impression I get from this research. But back to the question, am I having a disorder if I'm a highly sensitive person? We want to find out that in today's episode. And to answer that question, let's find out how to diagnose high sensitivity, so SPS first. So let's talk about the diagnosis of SPS here, of a sensory processing sensitivity. I found out that it's pretty difficult to find clear criteria for what we all want, a clear diagnosis for SPS. And that is because it is actually not classified as a medical condition nor as a diagnosis. But what is typical for highly sensitive individuals is a deeper processing of emotional stimuli and a lower tolerance for sensory input. I experience that pretty often, for example, in large cities, in metropolis, And if you're also a highly sensitive person, you might see that it's pretty exhausting, for example, for you to travel, to be around tons of people, to process multiple stimuli, and that you need to withdraw and take your time at some point of the day or at multiple points of the day. Especially highly sensitive people who do not know about their trait, which is the majority of HSPs, and I made a video about that as well. I'll link it up here for you. They try to catch up with routines and schedules of non-hypersensitive people, experience a huge spectrum of symptoms here. And these symptoms occur because they do not set up a proper environment for their high sensitivity. But again, try to set up an environment of a non-hypersensitive person because they do not know that they're highly sensitive people. And this not very favorable environment many highly sensitive people set up for themselves because they do not know about their high sensitivity causes a lot of symptoms which are created by their trait. So these symptoms might lead from, on the one hand, the strong feeling of over-arousal and feeling overwhelmed after perceiving a lot of stimuli, for example, in a big city or at an event, up to, on the other hand, the need to withdraw after having a lot of these stimuli, a lot of social interaction. Another symptom is that many highly sensitive people are really emotionally, especially highly sensitive children. They cry pretty easily. They switch moods very fast. Again, especially in highly sensitive children, this is observed a lot. I can remember myself being a really sensitive child, crying a lot. So that is a typical symptom for SPS. Another symptom is having a strong sense of empathy. So many highly sensitive people have a lot of compassion, can put themselves in the shoes of others. Then there is the tendency to depression and negative thoughts. I will make a whole episode about that topic and the data about depression in highly sensitive people, because I think it's a really interesting correlation that there is a lot of mental illness, that there are a lot of mental challenges, especially in people with SPS. And I think there are also a lot of strategies how they can deal with negative thinking, with depressive states. We came up with that topic also in the interview I made with Annabeth Rawson about therapy, and she said that 50% of all people seeking therapy might be highly sensitive people. So that is also an interesting observation here. There's also a lot of childhood PTSD, so post-traumatic stress disorder caused or created in childhood, which is pretty typical for highly sensitive people. I will also make an episode about that topic. Another symptom is insomnia in highly sensitive people and higher pain sensitivity. To cope with a lot of these symptoms, we highly sensitive people develop coping strategies, most of the time early on, already in the childhood, because we were not able to cope with this high sensitivity ourselves, because we were not able to feel in place and to feel right because of our high sensitivity. And I want to talk you through a couple of these coping strategies, which are on the one hand pretty favorable ones, and on the other hand we have pretty unfavorable ones, which create a lot of, let's say, dysfunction, a lot of dysregulation, a lot of other mental challenges in people with high sensitivity. So if you have, let's say, unfavorable coping strategies, you might create more suffering caused by these coping strategies. And maybe you didn't realize that before, but it's really interesting to see how unfavorable coping strategies can be a challenge themselves, because they protect you, they protect your self-worth, they protect you as a human being, as a really sensitive human being in a non-sensitive environment. So we start with the positive coping strategies here. Many highly sensitive people hopefully learned. So these are the good ones. These are really helpful. And the first one is withdrawal. It's definitely arguable if that's just a favorable strategy, but I think it's necessary for many highly sensitive people to take time on their own and to recover by doing that. Yeah, I think it's a strategy for many people as well, not just highly sensitive people, but especially for introverts as well. Withdrawing is something we all do from time to time. Just taking some time off, being with ourselves, just with ourselves, being alone, processing emotions and the things we perceive, the stimuli which entered our system. So that's a really helpful one. And we all should take our time just for ourselves regularly. I also schedule some time for myself. Let's say once a week I have a slot where I just know today is my day. Today I spend X hours just with myself. Then there is the strategy, second one, of reducing stimuli. You could also argue that complete avoidance, and I also say that again and again in the episodes, avoidance is not a great solution, especially not for highly sensitive people, but partly avoiding stimuli or reducing stimuli is pretty helpful. For example, when you are already overwhelmed, when you are in a big city, when you're at an event. Helpful tools can be sunglasses, for example, or blue light blocking glasses when you work on a computer late night, when you are out in the sun. Earplugs or noise cancelling headphones like AirPods can also be very helpful to reduce stimuli, especially when you live in a larger city or when you are generally pretty often with a lot of other people. Then there is writing and reflecting as a definitely favorable coping strategy. Brain scans show that the brain areas of highly sensitive people for self-reflection show a higher than usual activity, so it comes really natural to them to think and reflect. And using a notebook, your phone, or even a whiteboard to put all your thoughts on paper really empties your head and can feel really relieving and relaxing. So that's definitely a really helpful coping strategies for emptying your head and clearing your thoughts. The fourth favorable coping strategy is definitely therapy. Well, therapy is not just a coping strategy, but it is a strategy to learn more about yourself, to find real and alternative solutions, to find new strategies to deal with your personal challenges, but also to deal with your sensory processing sensitivity if you're an HSP. It's also really helpful to learn how to deal with a sensitive nervous system if you're lucky enough to find a therapist who is also familiar with the topic of high sensitivity and not just trying to figure out what might be wrong with you. So that's definitely a really helpful strategy to work with a therapist to find out more about your sensory processing sensitivity. Let's go on with 3 not very helpful and not very favorable strategies. I think helpfulness. I think helpful is the wrong word, because see it from this perspective, every coping strategy you learned somewhere in your life, even if it's eating, putting a lot of unhealthy food in your body, even if you have an eating disorder, it is still a helpful strategy for you, which you learned or which you use to cope with stress. So if you would not do that, you would probably develop some severe other problems. It is just like a shift from one stressor to another strategy here. Strategies in this category also are, for example, masking. This is hiding your true, authentic emotions and sensations here. And by masking, we lock in parts of ourselves because we think that no one might ever accept these parts. It's a strategy especially people on the autistic spectrum do, for example, also unconsciously. So they unconsciously mask. They often regulate the emotional state of other people, so they do not show themselves and what they truly sense. I think that's a dangerous thing. It's a really difficult and unfavorable coping strategy, because if you're masking, you never show your true self, and you can explode at some point, literally, inside, because you're not able to cope with it anymore. Then there is, as I said, avoidance, which is not the same as reducing stimuli. You can reduce stimuli in a situation where you're already overwhelmed, but if you completely avoid stimuli, you do not even enter a situation which could be potentially overwhelming for you. Avoidance is also a strategy from PTSD, as I said, and I will do an episode about that later on, about the combination or the question whether post-traumatic stress disorder is related to a sensory processing sensitivity. But for now, avoidance is definitely a strategy which many highly sensitive people, which many introverts, many people on the autistic spectrum also do to cope with stressors and stimuli. And there is dissociation, the last one, also part of PTSD. Dissociation is an emergency coping strategy of your body, of your brain, which technically takes you out of your body experience. When you experience dissociation, it feels like you're in a tunnel, so you don't perceive things happening around of you. So you're just in this really small, limited tunnel. Some people who experience dissociation also have difficulties to know what's going on in their body, so they really sense that there is like a hole in their body. So they're emotionally pretty cold. So that's definitely also not a very helpful strategy, but our bodies, especially in childhood, learned to dissociate to protect us. Let's talk about treatment and medication for highly sensitive people a bit more. When you found out that you might be a person with SPS, you might have asked yourself that question, so what? What can I do now? Is there any treatment? Is there anything maybe I should do? Is there anything I could do to make my life more easy, to better deal with over-arousal, to better deal with processing a lot of stimuli, and to learn to regulate my nervous system better, because that's the cause of all the over-arousal, that's the cause of all the challenges, that's the super sensitive nervous system we have as highly sensitive people. So when you are a highly sensitive person, you can definitely, and this is what I'm saying also out of my experience, out of the experience of many other highly sensitive people I know, you can definitely benefit from therapy. From therapy and professional coaching in general, you can take so many insights, and it's so helpful. It gives you so much relief, even more than this content here ever could give to you. What specific things you can learn from therapy as a highly sensitive person? And I made a whole episode, a whole interview with Annie Beth Rothen about that. I'll link that up here. So first of all, you can realize that you are a highly sensitive person and that there is nothing wrong with you. And that's a big step. Sounds so trivial, but it's a big thing for many highly sensitive people because many HSPs do not know about their highly sensitive trait. And again, it's pretty difficult to find a therapist who is experienced and specialized in the field of sensory processing sensitivity. But if you do find a good therapist who understands you, maybe is him or herself a highly sensitive person, then chances are high that you will gain a lot of insight from that person. You can also understand during therapy that your needs are okay the way they are, even if you learned that your needs might be bad as a child. This is definitely a huge thing for many highly sensitive children who experience that they are too much, that they are too sensitive, that their needs are wrong, that there is something wrong with them. So that's a huge step for them to understand through therapy that their needs are totally fine. They can also learn new survival and social communication strategies, not just avoidance, because also caused by that, just because they learn that there is something wrong with them, that their needs are bad, that they feel like an alien. They develop often difficult social communication strategies, which are not very helpful for them. So many of them, especially introvert, highly sensitive people, avoid social interactions and social constellations regularly to protect themselves from over-arousal. So therapy might be also really helpful to learn to integrate better social and communication strategies. Next to therapy itself exists a whole field of exercises to re-regulate your nervous system. So that is also a huge treatment for highly sensitive people where they benefit a lot from. Everything which re-regulates the nervous system is pretty beneficial for people with a sensitive nervous system. And there might be, for example, autogenic training. Maybe you know that. So you take a really helpful affirmation, repeat it in your head, and then focus on specific body parts. For example, I am calm and I'm secure, and you repeat that, and you feel that in your body. So putting a positive affirmation in combination with a body scan. Then there is meditation, and I do not have to explain to you what that actually is, because you all know. At least I have to say, for me, meditation is not very helpful, but I think that's an individual thing. Many highly sensitive people benefit a lot from meditation. Also, breath work is definitely a thing that regulates your nervous system. For example, if you breathe, if you really focus on the breath, if you touch your skin, if you get back in contact with your body in an over-aroused situation, that's super helpful to re-regulate. But what if all the treatment for you as a highly sensitive person does not work? Is there any kind of medication you can take to, let's say, reduce the challenges of being an HSP, to be less sensitive? I think that's also the wish of many highly sensitive people. I think medication for highly sensitive people is a pretty difficult field. I would say all in all, you don't need medication as a treatment in general as a highly sensitive person. But what you have to do is definitely you need to consider to adjust medication if you take it as a treatment for another illness. And that is because you're more sensitive as well to many substances, so you might need less. So if you take, for example, a substance and you are a highly sensitive person, you should talk about it with your doctor or with your health practitioner. If you are pretty sensitive for example, substances, you can also see if you are, for example, sensitive to caffeine or to nicotine. So that is also a great indicator to find out if there is a sensitivity to substances in your body. Nevertheless, some drugs might be helpful for highly sensitive people to deal better with SPS. And if you want to learn more about medication for highly sensitive people, I definitely recommend to you reading The Highly Sensitive Person, so the book by Dr. Elaine and Aaron. That's definitely super helpful because according to Aaron, some medications can be taken to deal with especially short-term over-arousal, and she talks about fast-acting and anti-anxiety drugs here. These drugs make you sedated and can also, that's important, make you addicted. So this is not a recommendation here. We are talking about drugs like Valium or Xanax. For long-term symptoms of high sensitivity, Aaron writes about antidepressants like Prozac or Zoloft, which tend to be less addictive, and they help you overcoming chronic over-arousal, which can lead to depression. Again, I personally am not a fan of any form of medication for highly sensitive people and in general. Aaron also points out that it's important to learn as much as possible about these drugs and also consulting a doctor in any case if you plan to take any medication for dealing with your sensory processing sensitivity. Other possible substances may also be cannabis or psychedelics here, but I won't get into these here because that would be too much for today's episode. In any case, this is definitely not a medical consultation here. I recommend doing a lot of research on your own before taking any drugs or substances. And if you want to learn more about this, definitely I recommend you the book by Dr. Elaine and Aaron. I link it in the description as always in our book list, The Highly Sensitive Person. To sum it up, is the sensory processing sensitivity a disorder or not? So the answer is probably not. It is a trait, a characteristic of a personality. Elaine and Aaron, as well as the DSM, point out that there is no association between a sensory processing sensitivity and autism spectrum disorder, but it still remains unclear if high sensitivity is a type of form of ASD. But the question is, does that really matter in the end? Because if someone or some organization labels you as having a disorder or a trait, what does that actually say about you as a person? The answer is nothing. Human personality is a hyper-complex field, and there is nothing wrong with you if your brain works just a little different than what society or whoever claims as normal. Also, everything in this world, which is, let's say, a challenge or disorder or just a trait, comes with another upside. And if you're a highly sensitive person, there are many strengths and benefits of being a HSP. I made a couple episodes about this already, but if you're an HSP, you might have a really strong sense for empathy. You might observe details many other people would not even recognize. You can read other people pretty good, and you might be a really good manager and an empathetic leader if you're a highly sensitive person. You have really good social skills. You're an amazing listener, which other people value a lot for. They love your deep insights you might give to them because you rethink things a bit more than other people. Because you sense your emotions and needs pretty strongly, you might know pretty well what you need and want inside. And due to your strong perception of details and the high awareness, you can scan the environment and sense dangers pretty early on. And also, in the end, you appreciate the beauty of life a bit more because you're able to perceive more of the outside stimuli, more of the outside aesthetics, and more of the outside beauty of life. So what do you think? Is high sensitivity a mental disorder? Is it just a trait? Or does it matter at all? Leave me a comment below today's episode. Make sure to subscribe to the Understandable podcast here on YouTube, iTunes, Spotify, wherever you listen to. Check out the book list in the description, and I see and speak to you in the next episode.